come to order. The first item on the agenda, review and revise the agenda. Any revisions to today's agenda?
Mr. Chair, there are just a couple of additional announcements under item number 9 that I'll include at the end of the meeting.
Thank you. Anything else? If not, we will move on to item 2, reviewing the minutes from our September 25th meeting. Please take a moment to review those and let me know if you have any revision. The revisions? No. All right, the minutes will be adopted as written. Item number 3, new staff introductions and employee recognitions.
Thank you, Mr. Chair. I'm going to pass the new employee introduction to Sandy because it is an employee that is supervised by her. And so I'll let her start with the introduction and then we'll move on to recognition.
Perfect. Yes, well, I'm very excited to welcome Bettina Naylor to our team. She is our administrative assistant too. You will see her smiling face at the front desk, and she has been a delight. You would think that she has been here for months, not a matter of just a few weeks. She is bright, energetic, and just thrilled about learning everything that we offer here through public health. I'm very excited to have her on the team. I think she's going to be a great long-term addition. And I won't embarrass you. Go ahead.
Thank you for all of that. I need to interrupt a little bit. My name's Bettina. I have been living in Helena, Montana for 25 years now, roughly. 2 adult children, a dog, 2 cats, and that's about it for me. So, and I'm really excited to be here.
Welcome. We're excited to have you. Good to meet you.
She makes our mornings walking in with our coffee and half asleep much better.
For sure.
Great.
And then our employee recognition. So what we do is it's a peer-driven nomination process within the health department. And every quarter we have nominations come in and a selection process that we have found to be extremely difficult. So we get multiple nominations that come in for really incredible staff that do really amazing work. And there's a small team of us that get to decide who is honored. It is always difficult because we have pretty incredible staff here. This quarter, we chose to nominate Keegan McClanahan, and he is our hydrogeologist with the Water Quality Protection District. He's not here today because he's in the field working hard. One of the biggest reasons why he was selected as our employee of the quarter is because he truly is MacGyver around here. So he's a hydrogeologist and spends quite a bit of time at his desk crunching data, and then he spends a lot of time with his waders on out in the streams taking measurements and so forth. But in his spare time, he is IT guru around here. He broke into a safe that we that we needed opened. Our outreach van that we have has needed significant attention to get it up and running and operational for all the things we want to use it for when we are serving the public. And he has been instrumental in identifying issues, fixing issues, and just all around great guy. Fred, would you add anything, because you've been working with him, especially on the van?
Well, the band's one thing, but just you talk about being a utility player too, and I had the pleasure when we did the joint workshop between 2 of the teams, water quality and the environmental health folks, up in Birdseye on sewer and well water and stuff, and in front of a crowd, being engaging, sharing the knowledge that he has. He's also extraordinary in that role, which you wouldn't expect from every hydrogeologist you've ever met. And so he really is a true utility player. And I'd also add on the van, the ask for him initially to take a quick look and see if he could help with a couple of things led to his own initiative of documenting, completing the writing of an instruction manual. So the pieces that were missing or wrong, taking photos, taking his own time coming in on an evening or waiting till everybody's out of the parking lot so he could pull it up and figure out how to get the water working so we can utilize that. Yeah, so you ask somebody to spend a couple hours assisting with the project, and he ends up spending probably 25, 30 hours over a 4-week period, finding out what else you should have asked him.
He's been pretty incredible. So sorry, he's not able to be here so that you can praise him, but again, out in the field doing the good work.
Yeah, thank you. Thank you for sharing that. And even though he can't be here, I think we appreciate the fact that of having the employee recognition process and the way that you do that. It's great. So good job for Keegan, but also thank you. Next up, agenda item 4, substance misuse and opioid prevention update.
And at this time, Mr. Chair, members of the board, I'd like to introduce you to Jacob. He is our, well, I'll let him introduce himself because his title.
You don't want to say my title?
Because I stumble on your title and you say it so much more eloquently.
Yes, I'm Jacob Biles. I'm the opioid overdose prevention and safer communities Montana coordinator here at Lewis and Clark Public Health, but I go by an acting title of a harm reduction coordinator because that doesn't take 4 hours to say. But I'm coming to you today on the opioid overdose prevention side of things to present on the Strong Roots Coalition. This is a new coalition that has come together here at Lewis and Clark Public Health and in the community through the combining of our previous substance misuse coalition with my opioid overdose prevention coalition. So now everything substance misuse, substance prevention, all goes through one group of folks here. But you can see our lovely new logo that was just designed not too long ago. But our main focus is, the education, advocacy, and the support for people in the community who are struggling with substance use disorders or anything to do with substance misuse. We have providers, we work with peer support specialists, we work with Shodair and St. Peter's and Peerview and other folks in the community as well. So we've got a pretty well-rounded group of folks from all of the different walks of life when it comes to substance use and how to prevent it and help the folks that are dealing with that. If you go to the next slide.
Well, I don't know that it's allowing me to work in presentation mode.
That's
Oh. Okay, there we go.
No, that's mine.
Oh, that is yours. Okay, now let's go back and where did it go? It was just all right there. Okay. Let me go find the right one.
Oh, there it is.
Okay. All right.
How about that?
Oh, it went a little too fast. There we go. I'm sorry. So sorry.
Great.
There we go.
Wouldn't have scared you earlier.
Yes.
So our Strong Roots Coalition strategic actions, this is pulled directly from the CHIP and our strategic plan that we've been working through. The focus being both on prevention along with helping support and recovery, medication assisted treatment or MAT services, or MOUD is another word for those services, working with providers that provide that service to folks in the community, the awareness and availability of our harm reduction items such as Narcan or fentanyl test strips that we distribute from here at the health department, and trying to expand out into the rural parts of Lewis and Clark County as well. There's actually 3 of us on staff that help with this coalition, but the other 2 are in Augusta right now for Red Ribbon Week. So you're stuck with me for the presentation today. We were just talking about the health or the behavioral health van, but it has provided some fantastic services all over the county through Narcan distribution, peer support services, addiction counseling, drug deactivation kits that we distribute as well, along with those fentanyl test strips. So we are getting supplies out into the community. As you can see here, this is just for the van itself. They've distributed 118 boxes of Narcan, 127 fentanyl test strips, some gun locks, Deterra drug deactivation kits as well. The Deterra number is actually higher than that. It just wasn't being tracked until like a week ago. So it is a higher number, although I couldn't give you exactly what it is. But for the public health department, our full Narcan number is just shy of 1,600 that has been given out since I started back in November of last year. And those 1,600 boxes of Narcan have gone all across the community here in Lewis and Clark County and to other surrounding areas as well through the grant from the state that funds this work. We cover a 12-county region. So 700 of those 1,600 made it down to Deer Lodge, where 500 went to the Montana State Prison, so they can provide Narcan to people as they're being released from prison. If they had a drug charge or substance use issues, they're being given Narcan as they leave the prison and are coming back into the communities. So we're really excited about the partnership we have with law enforcement. And our next big focus is to work with the schools in the area as well. So here's just a little bit more. As I mentioned, the 1,600 boxes of Narcan that have been distributed. I realized I forgot the N in region. We just yesterday did 2 pediatric overdose simulations with St. Peter's, and they did another 2 back in June. So we had a roundtable discussion with folks from St. Peter's and EMS. Myself and Julie attended as well to talk about spike response planning and what to do if we run into a large number of overdoses all happening in a short period of time. So we are excited to be working with St. Peter's, and we're going to be expanding those efforts a lot further. We've been working with DPHHS partners to start making a spike response plan because Lewis and Clark County does not currently have one. A spike in overdoses would be if we had 3 overdoses in 24 hours. And so our first meeting to start putting that plan together is going to be Thursday, December 11th. We are hoping to bring in first responders, other community members, folks that work in substance misuse, and anyone else in the community that wants to be a part of this. So that way we know exactly what to do if we do find ourselves with an increase in overdoses in a short period of time. And we continue to distribute lock boxes, locking prescription pill bottles, and the drug deactivation kits as well. Some of the big community events that we have taken a part in, the mental health block party back in May was another huge success, and the crew is already starting to put together our planning for the one that we'll be doing next year. So we're excited to continue these mental health block parties that provide just so much representation and knowledge to folks here in Helena and the surrounding area. You're going to hear a little bit more about it later, I think, but the Superman and Sober Delight events we had back in May as well, where Superman, the Native American hip hop artist, came and spoke about his life and his connections. He's never touched a drop of alcohol in his entire life, so came and talked at 4 of the different schools in the area about that, and then performed for folks in the rain down on the walking mall. June, we held our Coordinating Hope Summit. This was bringing together folks who work in substance use prevention or substance misuse, peer support specialists, and we had a almost full day's worth of classes and educational presentations for those folks, and a lot of working together so we know who's providing what services and how we can all help each other and how it connects. And Dodgepalooza, which was up in Augusta as well, where we invited the students and the kids from the Augusta area to come out and play dodgeball, and we were able to present on our substance use prevention efforts to their parents while the kids were getting to have a healthy, fun alternative. As I mentioned, right now is Red Ribbon Week. So our folks are up in Augusta doing other events with the students and spreading substance prevention materials. We'll be doing another Coordinating Hope Summit next year, along with the Mental Health Block Party. And we will be constructing that spike response plan over the next couple of months. And there's all three of us on the coalition, myself, Villette Burke, who is our substance misuse coordinator, prevention coordinator, something like that. And Vivi Tyler as well, who I'm not even going to try to guess what that.
Data coordinator.
There we go, behavioral health data coordinator. But happy to answer any questions anyone has. And if anyone is interested in being a part of the spike response planning, I printed a couple of these out so folks can know when and where that meeting is going to be.
Question. So I was working at the state on the opioid stuff, right, when fentanyl was made legal. How's the uptake on that been? And for Narcan, there's a like how to use Narcan. It's pretty easy to find. For fentanyl test strips, does it come with a how to use?
Yes.
Are people using them? Like, how's that gone?
Yes, the fentanyl test strips, because when they're shipped to us, it's kind of like a garbage bag full of test strips. So we have been putting them into smaller packages with sometimes 5 to 10 different test strips, depending on how big of a Ziploc I can find, and then adding instruction manuals that came with those orders as well. So multiple test strips with multiple instruction manuals to make it as easy as possible for folks to keep themselves safe. Any other questions?
I don't know if you mentioned this, so if I missed it, I apologize. But I think on the slide, in your slide deck, it said there's like a 12 county region. How is that determined? Like, how is that determined?
Yeah, so
Those counties.
that was determined by the state. They split the state into, I believe, 6 different regions, and they have 6 what are called OENDPs, which stands for Opioid Education and Narcan Distribution Program. So that we've got other folks in similar positions to mine, or other people that work in opioid overdose prevention efforts across the state that are all covering those. And our region that I cover is Lewis and Clark and Marr County down to Beaverhead. And so our big spots are Helena, Bozeman, and Butte.
Okay. Thank you.
I was just wondering, do you know if there's any statistics on how often those test kits are utilized in the community?
That's a hard one, because I don't know how often they're being used. We do get really good numbers on when Narcan is used in the case of an overdose, but the test strips, it's much harder to know if or how many are being used at a given time, unfortunately.
You're tracking how many get distributed, but beyond that, we're just hoping they're getting used.
All right. Anything else? No? Thank you so much.
Thank you.
Thanks, Jacob.
All right. Thank you. Agenda item 5, recovery friendly workplace.
So in your packet on page 9 and 10 are an overview and then also a frequently asked question document. We were presented this opportunity. Recovery Friendly Montana they're based out of Missoula, but are providing lots of support and technical assistance for organizations like ours to adopt a recovery friendly workplace. And so what this is an opportunity to create an environment in which people who may be struggling with substance misuse can find the support and resources that they need so that they can continue to be successful in the jobs that they do. You can see in the background there that it's very expensive for businesses and organizations to not address substance use. We don't want to get ourselves in a situation where we're losing really great staff because they're struggling with substance misuse. We also know that it may not be our staff, it may be a family member or somebody that's very close to them. And what's happening in their personal life can impact their ability to be productive and to do their jobs here in public health. And so when we were given an opportunity to learn a little bit about recovery-friendly workplaces, we had the gal come from Missoula to give us a little bit more information. As a leadership team decided that we would like to pursue being a recovery-friendly workplace. And so what this looks like is offering training to our staff, offering extra training to our supervisors so that they feel really comfortable and confident when they may intersect with a situation where substance use is the challenge. It offers us a checklist that allows us to kind of look through our policies and our procedures, which I am proud to say that the Lewis and Clark County, which is, public health is a part of Lewis and Clark County at large. Our personnel policies are already very strong in this way. So when we looked at kind of what are the requirements to be a designated work site, it's a pretty light lift for us because our county policies are already they're in great alignment with what recovery-friendly workplace expects. People are treated with respect. People our staff and employees of the county are offered resources. We have the employee assistance program available. We have great benefits and great policies. And so really we're adding on a little bit of training for staff and in an understanding of what it means to be a supportive workplace for somebody who might be struggling with substance use. So I wanted to bring this to the board, let you know that this is something that it's an internal program that we are doing as a staff. Can I answer any questions for you?
Is there any plans to offer this to businesses in the town?
So what we would do if there are businesses that are interested is connect them with, help me with her name? Shannon in Missoula, because she's the one that does the orientation and the designation. There are other organizations in Helena. St. Peter's has been designated.
YWCA, I think the Double Figure, maybe a different hotel is working on it as well.
Yeah. And then on their website, you can see all of the organizations and businesses that have been designated up to this point. So if there are organizations that are interested, we can certainly get you hooked up with Shannon and send her your way. She's fantastic. She was willing to come travel in person to be here with us twice. So
Wasn't quite sure. I don't think I quite understood from what you said. Is the designation for the health department or for the county, or it just so happens that the county's already doing yeah, can you?
the policy part of what's expected to be designated is through the county, and we didn't have a lot of work to do there because the county already has really great supportive policies in place. The designation is for the health department.
Okay.
Yeah.
Great.
We did share this all with the human resources with the county in case there were other departments within the county that would be interested in doing something similar. But it's something that our staff and our leadership team wanted to do for our staff within the department.
Just a question, talks about the checklist.
Yeah.
I was looking to see if there's a link and I didn't see it obviously
Yeah.
anywhere.
Yes. So I brought the checklist up on my screen in case that question came up. So the checklist includes things like doing the orientation, so which we've already done. Shannon came over and provided an orientation about recovery-friendly workplaces, writing a declaration. And so our draft declaration that we are working on right now states that Lewis and Clark Public Health is committed to creating a healthy, safe, and stigma-free work environment through our participation in the Montana Recovery Friendly Workplace Initiative. The Recovery Friendly Workplaces encourages environments where employees, employers, and communities can collaborate to create positive change and eliminate barriers for those impacted by addiction. To fulfill our mission to improve and protect the health of Lewis and Clark residents, we invite and encourage all employees to reach out for help and support for themselves and their families. And then the other parts and pieces of the checklist are going through our policies to make sure that they are recovery friendly. And that's with help from Shannon and the main office, doing the trainings that we're required to do, like one activity a year, that helps our staff remember that we're all here, we're in it together. We're in it together. There are resources available. There are benefits through the county that are available. So it's they really do encourage us to have an ongoing cadence so that it's not a forgotten effort. So the checklist includes things like that.
Thanks.
Anything else? All right, thank you so much. All right,
Get me again.
yeah, item 6, fiscal year 26, quarter 1 finance report, is that correct? Quarter,
It is.
okay,
Yeah, quarter 1 for our fiscal year is June through September.
right.
And so you're getting the quarter 1 financials. Thank you, Miss Sandy. So would you back up one page?
I wish, oh, come on.
There,
Whoop, hello.
yeah, there we go. So it wasn't in your original packet, but added later. So I'm not sure what page it is in your packet. But this first page summarizes revenue that has come in the first quarter of the fiscal year, and then also our personnel expenses. So at the top, you see what the revenue has been. So we're 25% of the way through the fiscal year. And we have collected just over 7% of our revenue. I'll just, as a reminder for board members, our largest revenue source is property taxes, and those are not collected until November and then again in May. So often we won't see those property tax revenues until the next quarter. And then another big revenue source that you'll see happen in the next 2 quarters is our fee for service. So as we do our immunization services this fall and we submit for reimbursement to insurance companies, that revenue then starts to flow in the second and third quarters. If it's up to Sandy, it's going to flow in immediately. And she is already way ahead of schedule on billing all of the clinics that we've done thus far. So you probably will be seeing that revenue in the second quarter, which is new for us and excellent for us. And then grant revenue, of course. A lot of our grants are reimbursement based, and so we submit reports and then wait for reimbursement to come. And so those are some of the reasons why you don't see a lot of revenue in the first quarter of a fiscal year. The second section down on this page is all our personnel expenses. So for personnel, we are actually 27% of the way through the fiscal year because we had an extra payroll run in the first quarter. And we're spending as anticipated. So if you look across the chart to the second to the last column, it says percentage of budget spent. And then look down at the end of that column, we're 26.89% spent of our personnel. So we're right on what we had anticipated being at this point. Any questions on revenue and personnel before I move to the next page? So the next page then reflects our operations expenses. And I don't know, Sandy, how hard it is to zoom that in just a little bit. It's kind of hard to read. Heather does a really great job of putting as much information as she can on one page. She's brilliant. And so what you see on this page are all of our operation expenses. So things like travel and printing and supplies, those types of categories within our budget. Again, we are 25% of the way through the year. And if you scroll down to the bottom, and then second to the last column, I don't know, Sandy, if you can highlight the 10.95% for me. Yep, right there. Yep, right there.
Right here.
10.95% is how much we have spent of our anticipated budget. So at this point in the fiscal year, we are underspending our operations. And then I just want to highlight one more thing for you, and that's the middle box at the bottom where it says cash flow and year-to-date actual. So at the beginning of this fiscal year, we started out with $1,085,000 to start the fiscal year. And so far, we've brought in 191,000 in revenue. We have expenditures of 480,000. So we have an ending cash balance of 797,000. And so what that equates to is 97 days of reserve, which is above our goal. Our goal is 90 days of reserve. And then the highlighted to the right at the bottom, that 574,000, that's where we were sitting this time last year. So in comparison, our ending cash balance is healthier than it was at this time last year. And we are meeting our goal of 90-day reserve. And we're doing that without revenue. So if you remember at the beginning of my presentation, our revenue has not come in yet. So we are maintaining our goal of 90 days without having our revenue come in. So I would say all in all, healthy fiscal outlook at the first quarter of the fiscal year.
Congratulations.
Thank you. It feels better to do these reports now. 2 years ago, I was sweating bullets doing this presentation. So, yes, sir.
Question of, are there any grants and whatnot that you have had in the past that have just been turned down at this point?
Not turned down. So all of the grants that we anticipated are coming through, with exception of one, and that was part of my announcement. But I'll just say it now, and I can say it again later. WIC is the only one that we're waiting for the federal government to pass a spending bill so that we can have our WIC money for the fiscal year. We get our WIC, so Women, Infant, and Children Supplemental Nutrition Services Program. We serve pregnant women and families with children up to 5 with nutrition benefits that they can spend in the grocery stores to buy vegetables and cereal and milk and things. That program is funded on a fiscal year, October 1st through September 30th. And we have not received those federal funds because there isn't a spending bill that's been approved at the federal level.
But I think it's in both bills, both sides.
It's in there.
Yeah.
I'm
Just a matter
sure-
of getting them back to work.
I'm sure that we will eventually get it. It's
Good.
just a matter of when they pass that spending bill. So in the meantime, the state is backfilling the WIC program until November 30th.
Good.
And if we still do not have an appropriations bill passed by then, or a continuing resolution by then, we have contingency in our budget. So on line 939.10. So I don't know, Sandy, if you can find that. It's contracted services.
Right here.
We have $672,000 sitting there. It's because we anticipated this. And if the federal government doesn't come through with funds by November 30th, which is when the state said that they can cover until November 30th, we can cover for the rest of the fiscal year because we planned for it. I sure hope we don't have to. The unfortunate part about that is that we could pay staff, but we can't pay for the benefits that we give families. And so our staff would end up working really hard to connect our families to other resources in the community that may or may not even exist. So it'll be a really tough day if we get to November 30th and we don't have our WIC contract. But it's the only one at this point. All of the other grant funds that we anticipated, we are receiving.
Good.
This year.
It's what you've done in anticipating those costs is really important.
It is.
I think that's
Mhm.
it seems like every time that we think we've got a little extra money, there's something like this happens countywide, but there's always emergencies.
There is.
So,
Which is why that 90-day reserve is so important to
You bet
to
it is.
maintain. In case of emergency, we have funds to
Yep.
keep going.
Are we working on developing the contingencies for things like formula?
It's gonna be hard because what we have done is we plan for staff, but it's the
Wait, sorry, what was the question?
formula was the question.
Yeah.
So the formula and the benefits for families, that's why the program exists. So our staff they're the ones that are gonna hit the streets and they're gonna be working to figure out what to do. The state office is gonna be also working on it. I think they're working on it now.
Do
Like
most food
backup.
banks have,
Say that
do
again.
like food banks have, I mean, assuming they get it through WIC.
Yeah, yes. Yes. Yeah, so we're gonna have to get creative. There are formula companies that partner with WIC. And I am hoping that public-private partnership will solve that. Because we do have formula companies that are committed to the WIC program. And I'm hoping that they will help if we get to the point where we don't have money and we need families to have formula, so.
I'll ask too, at the hospital, we're baby friendly, we can't give out formula
Mhm.
hypothetically.
Mhm.
I don't know if this would count as in.
Yeah, as an emergency, there's an exception to all policies. What other questions can I answer about fiscal year 26, quarter one?
Job. Very good job.
Right, thank you.
Thank you.
I just want to reiterate that there are not a lot of counties that do that advanced planning like you're doing. And you're really setting a great example by doing that.
Thank you.
Yeah, a sign of a good budget. No questions. Very few questions, rather.
That means my presentation must have been thorough.
Yeah.
So, good.
Yeah, thank you so much.
Yeah.
Agenda item 7, the communications update.
Good afternoon. Sandy, do you want to pull my presentation up? My name is Amber Johnson, and I'm the communication specialist here at Lewis Clark Public Health.
Hold on,
And-
I'm trying to find yours. I'm sorry.
That's all right.
Let's get rid of you.
So she's down on your bottom menu.
Oh, there. Okay.
That's the
And
PowerPoint presentation.
this one right here. It says
Nope, that's the next one.
Um,
PowerPoint. Do you see the
I
PowerPoint?
see it. There it is. There it is.
You can scroll back real quick. So.
We're-
In the
I was gonna
beginning,
say there we go. Okay.
we need a title page to start this presentation appropriately.
Okay.
So I just am here to give you a quick public health communications update. About highlights, projects, plans that we have for the future. Should I close it? Thank you. So one of the first highlights I'll talk about is just our alcohol education campaign that launched basically over a year ago with the community questionnaire. And kind of from that, I worked with the Strong Roots Coalition, which you heard about earlier from Jacob's presentation, because we know that alcohol is a drug. In fact, it is probably the most used drug. It's also the drug that kills and injures more people than all other drugs combined. And so this was written into our strategic plan, is to do an alcohol education campaign. So we had some extra funds and were able to bring in Superman. If you've had the joy of watching him perform, he's a really incredible communicator, really incredible performer, and he does have a really compelling story about alcohol and substance misuse in his family and the choices he's made to like refrain, and how that's just aided his success in art and in life and family. So he communicates so well with children, teenagers, adults. He was awesome. He came to 4 schools, presented in front of like 1,700 kids. Very impactful. We had a Sober Delight event at the Helena and partnered with the Helena Indian Alliance. And we had 63 people show up, and we had just a great community conversation about alcohol. And then we had a rained out concert on the Walking Mall. I was a bit sad about that, but it was still great. We ended up taking an alcohol questionnaire, and I shared, we got such incredible stories. And I'm still flushing out what to do with them, but we did use our Substack to publish, I think 7 different answers to 7 different questions found in that. We just had another Sober Delight event, not as well attended because we didn't have as much funds to advertise, but what the hope and dream is that the community would take ownership, right, of culture change, because there's only so much we can do. But it's a matter of trying to get that education out there to empower the residents to like make healthier choices for themselves and to influence their community in positive ways. And so with the people that have attended our events and love, the opportunity to get together and talk about it, we have JC Sampson with Alcohol Free Montana. We just had a meeting with Quench, which is the new kind of like smoothie, coffee, juice bar / mocktail bar on the Walking Mall. And we're all going to partner together to put on just some regular alcohol-free socials in just a fun environment. And then hopefully we'll be partnering with Our Place to throw more like socials and parties, because while 12-step programs and like sober communities are so important to people's recovery, people also just want to hang out and have fun together and be able to do so in an alcohol-free environment. So, and hopefully we'll just continue working on community partnerships with Strong Roots Coalition. And then I'm hoping to do a future video project using those alcohol stories, because the truth is people don't read anymore, but they love watching videos, especially short ones. So we're going to try to lean into that and see what happens. Create a creative project in the future. You want to scroll to the next slide? Here's just some program marketing highlights. Everything from our well and septic workshop, which was a collaboration between environmental health and the Water Quality Protection District. That was very well attended. I think like 50 people showed up. It was a great event. Everything from our annual junk car removal services ads. Tell all your friends. And then of course we have our upcoming community baby shower. Hopefully you've heard about it at this point and seen it around town or seen it online. And then we just started, we just put up some billboards. I think you heard about that last month. Some WIC billboards. And then of course we had our, a bunch of vaccine clinics this fall. There's some marketing highlights for that. And then you'll see over there, I was a poster for breast cancer. It's our, obviously here at Public Health, we offer for uninsured or underinsured women, free breast and cervical cancer screening. And so a lot of times people just don't know, right, that there are services available to them. And so that's the challenge of public health communications is like, part of it is just sharing that education piece. Next slide. Obviously it was, we had our first case of measles. In like over 30 years, I think 1990 was the last year that Montana had measles. I think everybody remembers it started in Gallatin County. There was some in Yellowstone County, Cascade County, and finally was it April or May? We had our first case of measles here, this summer. We had our first, I guess we had our first exposure this spring, and then we had our first confirmed case of measles this summer. And so when that happens, we go full force. We have an entire ICS team and communications is a huge piece about educating people about measles and then stopping it in its tracks, which is successful because even though we technically had 2 cases of measles because they were in the same household, but information, both internal and external, was effective and we didn't have any spread. So We used social media posts, press releases. We did interviews with media. We did radio ads. We did television spotlights. We created a lot of signage, which I'm sure that you see when you come in and out of public health and about peer review. So I'm trying to pull out all the stops and communicate as effectively as possible so that people know what to do and what not to do, you know, if they've been exposed to measles or if they have measles. So this was kind of a fun summer highlight. And maybe a lot of you don't know about the life and the work of Maurice Hilleman. He's a Montana boy, cowboy from Eastern Montana, grew up on a farm there in Miles City, and was a graduate of Montana State University in Bozeman before he went to the University of Chicago, which at its time was the premier institution for medical studies. And he became a doctor. He also taught the first virology class. And he's probably the most famous scientist of the 20th century that nobody knows about. He created, I think, 9 out of the 14 of the childhood vaccines that we give to children today, both in the United States and across the world. Maurice Hilleman invented, including he invented MMR. So he was the first virologist to put multiple vaccines together in one shot, which we have been using since the 1960s. So to great success. I would encourage you to, there's a book and there's a documentary out if you're interested in learning more. The documentary is called A Perilous Quest to Save the World's Children. And it's about his life and his work. And then Paul Offit, who is the expert on childhood vaccines, and he's with I think the University of Pennsylvania, the pediatric clinic there. He wrote Vaccinated: One Man's Quest to Defeat the World's Deadliest Diseases. So if you'd like to learn more about this man, I'd highly encourage you to do so. Like, a lot of people here in Montana have never heard of him, even though, like I said, he's probably one of the greatest scientists of the 20th century that a lot of people have never heard of. So highly recommend that you do a deep dive and learn more about him. It's such an inspiration. And we shared it on social media and it got like 2,000 likes, 1,000 shares. And so it wasn't just shared here in Montana, but it got shared across the country. And as we continue to combat misinformation and disinformation about vaccines, being able to link the story of their creation back to, you know, making it humanizing it is like so important. So I guess future projects and plans. I am in the middle of a media art. I just started a media art certificate program. So that I could, I'm going to do a deep dive into more video production skills, because again, people are reading less, watching more, and I want to be able to communicate more effectively and communicate effectively to younger people as well. So I'm in the middle of a certificate program. And with that video production skills, I want to do a video storytelling project with those alcohol stories. And then finally, see the 2026 block parties. I think that's in your handout. That's something that we're going to work on. Is that in the handout? Yeah.
Yes.
Okay. So we would love your support, participation, however you want to be involved. We're putting together a stakeholders meeting early next month. And it's really about, I think you see the 4 objectives. Does anybody have any, should I go into detail, or does anybody have questions about that in your packet? No. Okay. I know I need to rush along here. So I am going to introduce Bajar and Jasper. So also in your packet, you should have gotten a little pamphlet about the YCD program. Yes. So we have visitors. And they're visiting from Indonesia and the Philippines, and they're coming through the YCD program, which is a program from the State Department. And it's kind of managed through the Mansfield Center at the University of Montana in Missoula. And they connected with us here, and we said, heck yes, because you know, the world is a small place and global public health becomes real small, real fast. And so it's a real privilege to have them travel from halfway across the world to join us here in Helena, Montana for a month. And so I wanted to introduce them to you today, and then let Fajar and Jasper tell you a little bit about who they are, and Yudon can introduce himself as well. And they've been working with me on some creative communications projects around sexually transmitted infection communication and prevention. So on that note, I will let you introduce yourself.
Right. Thank you so much, Amber. Hello, good afternoon to the Health Board. Thank you for having us. I'm the extrovert one, so I'll lead this discussion. So my name is Jasper, and this is Fajar, and that's Yudan. So before anything else, would like to share to you that I think I see in your briefs that we're talking about Young Southeast Asian Leadership Initiative. And if you could see that there are 4 themes or 5. You're at the civic engagement. So basically we're here because of what we are passionate about. And it's basically on community, our contribution to community health or community civic engagement. So let's talk about who we are. So quickly, I would have, because Yudan is not really working in here for quite some time, but he has a placement here. Yeah. So full-time, it's me and Fajar. So I'll give the floor to Yudan to introduce himself to the board.
Okay, hi guys, my name is Yudan Triana. I am from Indonesia. I am as a medical doctor focusing about OBGYN, health reproductive on female reproductive and pregnancy. I'm running the program. It's called Gerakan Bumil Sehat or the Healthy Pregnant Woman Movement because I'm living in rural area. It's need 5 hours to go to the nearest hospital. So I run the free ultrasound to people who are uninsured and can afford to go to the hospital or the clinic because the closest public health center is about an hour from their place, and we have no any public transportation, so they need to borrow the car or vehicle or anything. If they have not any kind of the vehicle. So I run the program because in Indonesia, we are facing the maternal death and we are the big 3 of the Southeast Asian. And my place is in West Java, is about 10 hours to the closest airport. So I need 10-hour drive from the airport to go to my places. And it's, in a year, we facing about more than 100 female die because of the delivery things, and we're facing more than 30 in a year of the neonatal death. So my focusing about that because I want to people have to give have their right to go to the have maternal care because it's a right, not something that are really needs to. So yeah, I running this program in my place.
Right. Thank you so much, Yudan. So our team here, Fajar and I, we prepared a short presentation of what we've been doing. We do it, please. Thank you so much. We appreciate that. So allow us to introduce ourselves. So basically, we're in this program, we're in here to give help to you guys because we're just gonna be here and not do anything. That's okay, right? We're just gonna go shadow enjoy Helena and do things. But in here, we decided to work on a project we will be sharing with you. So you say that in your language?
Yeah. Agak Kareba, so it's like
Mayung Hapon, that's the good afternoon in our country. That's our language. So, you know, a little culture before we start. And now I think I'll give the floor to Fajar to introduce himself.
Okay, thank you so much for the time and the commissioner and the member of board. My name is Muhammad Fajar Pahir, but you can call me Fajar. I'm a bachelor of public health back in my country, and right now I'm working as a technical officer for distribute public-private mix at non-profit organizations called Yamali TB, focusing on tuberculosis prevention and control. Just for information, Indonesia is the highest burden of tuberculosis in the world. Like we are ranked secondly in the world after India, and estimated 1.80 million cases every year, like an estimated 1 people die every 4 minutes because of tuberculosis. And yeah, and my place, Makassar, my town is the highest burden of tuberculosis in my province, South Sulawesi province, and we're working for outreach, like promote tuberculosis in the community, like assisting people with tuberculosis for their treatment journey, and also
refer them to the healthcare if they have a symptom of tuberculosis. So we work hand in hand with the government, public health department to set our goals to end TB in 2030. Next slide.
All right, so allow me to introduce myself. My name is Jasper. I'm a medical doctor back in my country, but I also run a nonprofit that focuses on young people's health. And I'm very happy to be here because I get to learn and to share what we do best back at home. I have noticed that here in Montana, maybe the rest of the US, we're not young people centric. We don't have a lot of programs focused on them. And that's something that we wanted to explore while we're here. And if you can notice of all the credentials that I have, I'm really passionate about building a community where young people are given spaces and tables where decisions are made. Because I think that health is really for everyone, and doctors should not be I'm a doctor myself, but I don't want to be the center of it all. Because I'm happy to see a board of health here that we are diverse when it comes to our backgrounds, and our lenses are very much warranted. I'm seeing a different affiliation here in our attendance, and that's very beautiful. That's a start. Now, what I focus back at home is HIV. Like Indonesia, we're also #1, growing incidence around the world. Also teenage pregnancy. We have a lot of problems, come to think of it. But nevertheless, we take it one day at a time. And why I'm focusing on young people, because they're the ones that having this burden back in my country. And going in here in the US, it's more of like a cross-cultural learning. We wanted to learn from your strategies and at the same time, maybe contribute what we think we could improve on. So next slide, please. So Fajar and I are basically here for the YCD Fellowship along with you, Don. And we're very happy to be placed here at Pure Public Health and PureView. So basically, just to give you a heads up, what's happening here is that our work back at home, we're being screened for this very competitive program. And then what they do is relate what we do back at home to a placement here. So the Mansfield Center basically matched Fajar and I here to work with you guys. So this is not just serendipitous, it was deliberately done to be with you guys here. So going back slide, so we'll just quickly share our learnings and maybe what we can say we could improve on the county level. Because what's good with working with Amber, our road manager, is bringing us around. We've been attending government days, we've been exposed to your programs. And as once people work in public health and as medical doctors, we get to see a perspective. Although we can practice medicine here, we get to shadow and share thoughts coming from someone who's like in a third world country. And maybe we could share what you guys have best, and maybe those are good practices that should maintain. And I think that's what we offer here, a fresh perspective coming from other side of the globe, and tell you that this is the good things that you're doing, and you have to continue doing that. And at the same time, where we think you could still improve on, because like if we can't improve on something, I think what's the point, right? So Fajar, take it away.
Thank you so much. So yeah, I'm so happy to be here. Like it's a privilege for me. Like I'm from Indonesia and go to USA, and not everyone have a privilege like me. Like have a placement in Lewis and Clark Public Health and learned from all of amazing people here, like sharing stuff, have a discussion, and even learning from all of things about public health here. Like you can see all my learning. I have a lot learned about the US public health system here, and like I mentioned before, I have a lots of discussion with the government body, the individuals working in public health, the staff in the Lewis and Clark Public Health, and lots of field trip. And I learned a lot about how the public health service delivery here, like vaccine clinic that I joined the vaccine clinic in a lots of different place in Helena, Montana, and yeah, and also learn about working environment here. It's quite different back in home. Like you guys is very punctual, and yeah, that's a good thing for me, like for us actually, because yeah, sometimes we try to be punctual if you have set a meeting, like yeah, it's 1 p.m. but yeah, sometimes it's like 2. So yeah, it's a good learning because you guys are organized, and you set every calendar, every event in a calendar, and yeah, it's just motivate me to do something back in my country, even though in just in a small place in my office probably. So yeah, and I also learned about how you guys very nice to me, especially when I my very first day in here, every stop like welcoming me with very kindly and very generosity, and I feel like I'm part of you guys. And yeah, the most important one, the cultural exchange. Like I have a chance to get a culture of Montana and share a culture too to people here, like share my culture in Indonesia. When I studying every stop, like have a discussion with them, comparing like what happened in Indonesia and what happened in the US. And yeah, have a trying the food, and yeah, I cook a lot here too. Even though in Indonesia I never cook, but I try to cook too. Cultural exchange, like I try my best to, yeah, I just introduce you to our local food and our culture in a food. So yeah, and overall, it just remind me that public health is a story of people. Like it's people's fear, people hopes, the people people hopes. And yeah, in the past 4 weeks I just being part of this story, and yeah, I'm so glad and I'm so happy to be here, and yeah, lots of learning that I can implement it back in my country. Thank you so much.
Right. Thank you so much, Fajar. As for me, on top of what Fajar shared, I'm really happy to have a lot of learnings. For one, what I appreciated was attending the government days. I'm happy that you're having close network with your people. I believe that where we talk here in this room, we should cater to those who are not in this room. We represent them and we should talk about their agendas too. So having government days for me was very nice because Sir Tom has heard me talk a lot of times. And I think I have the opportunity to say it again to the board. Back at home, I'm also part of the health board. I represent the youth. So basically, young people are given a seat at the table back at home. And then every time I talk, I always tell them that health is everyone's concern. It's not just the doctors, nurses. And it should be a priority because once we have healthy people, we have productive human beings in the community, we boost our economy because we have a working force. So that's basically it. So when we look at it in that angle, we would have this matter be a priority as well. It's not just because you're a doctor, you're for health, you're an accountant, you go with money. No, it's not that. It's a multi-sectoral approach all the time, and that's public health. And that's what I like here because public health is given premium. It's not just because a pandemic happened. I've been shown this one. I really like this so much. This is done with, for, and by the people. So this is a very good practice. I love you guys for, is this available online?
And she made that.
Oh, good to see you, Val. Good job.
To your point, I did not make that. Community did.
Oh, yeah, sure. So yeah, if ever this is available online, we would love to benchmark on this because this is a very good basis to show people that you are hearing them. Public health is about getting things done and letting the people know about it. It also boosts the agenda of everyone. They know that the people who are in position are actually listening to them. So it's a win-win situation. You do your job, which they notice, and they also get the benefits from it. Second is cross-cultural learning. I really love how both cultures here are being taken care of. Like in the Philippines, we don't do small talks. So when we see each other, like, hey, how are you doing? I would really literally like stop and, hey, how are we doing? And we'll spend 30 minutes of the time talking about how we do other lives. But here, small talk culture is good. And looking at the workplace as well, I really love how we're more horizontal than vertical. Let's say Jendra in the Philippines, and let's say Fred as bosses in here in public health, you will not reach them in high top ranking corporations. But in here, because it's horizontal, you get to see them every day, you get to talk to them, say hi to them. And that makes employees feel that they're part of something big, the decisions were made. And I think that's very important. Management style as well. I see leaders who are actually that are listeners too. A mere fact, you're wasting your time listening to us is a big plus for us. I mean, we'll be leaving in 2 days and you won't even remember us. But the fact that you guys are giving us time to be heard is enough for us to feel special. And I think you're doing that to all of your employees because that matters more because they're the one working with and for you. So I think a management style that fits your community is what's best. And lastly, shared heart and passion for public health. Earlier, we said our goodbyes to the people we work here. And these people, I know they're doing this because they have bills to pay. Maybe you guys too. But every time we ask them and shadow them and we ask about what they do, you see that certain spark in their eye, which means that they love what they're doing. And at some point, even if we have responsibilities outside work that would need us the money and cash to do that, it still make us, there's still more reasons to do what we do. And everything that you do and we talk about here, it means one life saved out there. Val works in epidemiology. All we see are numbers, but those numbers are lives. And always go back to what if that certain number is you or your children or people you love, your partner? Would it matter more now? It's always about perspective, and that's public health. So as a gift, next slide, please. Since we're working with Amber and she's in comms, and we believe that since we cannot practice our medicine because we don't want to be HIPAA and lawsuits coming to both companies, we wanted to be of use because we're creative and young and a little full of energy and something that's close to us. Yeah, we've been bothering everyone here. It's been so loud for the past 4 weeks because of the 3 of us over here. So we wanted to give a gift to them because if there's something that we think both companies could work on, or let's say it's their social media campaign. Well, for Lewis and Park, they're doing great. But for me at PeerView, I really told Maddie, hey, you have to up your game because everyone's in social media, young, old people. And if we want to continue the process of getting this information going on, we should compete with misinformation and disinformation. And we are in that position to do that. So those are the things we're working on. So we were looking at Myth or Fact series for STI. Although it says here that it's not your priority, but since that's what we're very passionate about, that's what we did, and we don't wait for it to blow off as another endemic or pandemic. Then we also highlighted services such as your mobile vans and immunization, which are a little, there is a vaccine hesitancy around, so we wanted to also combat that. And we went to look into, this is a special project by Fajar, the STI prevention documentary, because we wanted to show that public health is not centered about healthcare people alone. It's a concern of the community. It's basically putting this in a video. Yeah. Because we want, this is a brilliant idea. Yes. You guys are doing well. So just, to cut the yapping, allow us to show you our project. So we'll give you two of our videos, allow us to show you what we've been working on and see and how it works for you. Oh, sorry. Next slide, please. Okay. So we've been busy the past days because we don't want to waste their space. I'm sorry. Can we just please?
My name is Fajar. Today we're about to comment about chlamydia, one of the most common STD among young. Let's go. Every woman can get chlamydia.
Myth: both men and women can get infected.
Chlamydia can cause infertility if untreated.
Fact: untreated infections can damage reproductive organs.
Once treated, chlamydia cannot come back.
Myth: you can get reinfected if exposed again. Your treatment does not make you immune.
Chlamydia is curable with antibiotics. Get tested, protect yourself, and don't be afraid to talk to your medical provider.
Contact us at Lewis and Clark Public Health with your health center or your healthcare provider for management of chlamydia or other STI.
Let's move on to the next video. Thanks so much. So we have another video. Hi, and welcome to Myth or Fact series STI edition. My name is Jasper, and today we're going to talk about gonorrhea, common sexually transmitted infection affecting men and women. Let's go. Only people who have multiple partners can get gonorrhea.
It's a myth. So anyone can get gonorrhea if they're sexually active, even if they're monogamous, if their partner is infected.
Gonorrhea only affects the genitals.
That is a myth. If you practice unsafe and unprotected sex, gonorrhea can also infect your eyes, your throat, and your rectum.
If you've been treated, you can't get gonorrhea again.
That's a myth. You can get gonorrhea again, and you would need to be treated again. You're not immune from being treated once.
Gonorrhea is curable with antibiotics. Just remember to protect yourself, get tested, and encourage your partners to get tested. And always remember it's okay to talk to your healthcare provider about it.
Contact us at Lewis and Clark Public Health, PeerView Health Center, or your medical provider for management of gonorrhea or other STIs. Great. Thank you so much. So basically that project is like a culmination of all the 4 weeks that we're here, getting to know your stories and the thoughts of the public. And basically, we also looked at this. We wanted to look at your output the past few years, and we've noticed that these are things that might be booming soon if we do not talk about it, because we don't talk about sex every day. But we do it nevertheless, right? So it's something that we want to put in there. I know it's not your priorities. I've read this, but then again, it's good to shelf it over there in case we have plans to up our game on STI. We have materials. And this is just a reminder, if you notice, we got everyone, even Sandy from admin, to talk about it, because we want to show people that health is for everyone. It's not just for the people in this very room, but they could be the ones also taking action to their own health. And I think that's what public health is about. So thank you for your time. We're very happy to present that. And if there's anything you would like to ask or know about us, or comments, but not now, we just want to tell you we're very thankful. You say that in your language. Go.
Kuro semangat.
And madamo nga salamat. That's our way of saying thank you back in our country. And we're very happy to be given space here to talk. And thank you for appreciating what we do. And again, even if we're back at home, you could reach to us if there are strategies you would like to know from our countries. We could smuggle them in through our emails and tell you what we do best back at home. Maybe you could learn from our public health agendas and priorities, and maybe we could help out. And that's the perk we could give you, because you guys were very kind to us, and we'll give it for you. Thank you so much. Thank you, Mr. Chair and Health Board.
Thank you so much. Wow. Well, I guess, does the board have any questions or any comments before we move on?
That's awesome. Thank you. Much appreciated.
Thank you so much.
It's been a real pleasure having them here in the health department. The energy that they've brought to our space has just been infectious. And I use that like tongue in cheek. They worked on STIs, and you don't want them to be infectious, but their attitudes are, for sure, and their positivity, and their just had so much fun, and it was great to have them here. I can't believe that their time is up.
Yeah.
Oh, no.
4 weeks.
I know,
went really
it's like,
fast.
it's like they got here yesterday. And I will say, having them, like, we know that, Helena, we're an older community. I love to see young people in the room. And so, but something that really inspired me to do, it's a long story, but 2.5 years ago when I came on staff, because of the transition from the previous communication specialist, we lost access to basically our Instagram and our business portfolio. And so Instagram has been sadly lacking. And it's such a great way to reach young people, which we just haven't been doing as effectively. And I've tried and tried and tried and tried again for 2.5 years. It's been a saga, but having Fajar and Jasper here really inspired me to making communications to and for young people more a priority. And so I tried one more time, a different route, and we got it figured out. We have access to our business portfolio now. We'll be using Instagram a lot more frequently. And had they not come and inspired me to try one more time, and just making sure that our communications to young people are more of a priority, even if we have an older community, like making sure that the young people feel seen and like we're trying to communicate with them. So I'm really grateful that they were here and they were so wonderful to work with. And it's going to be sad to say goodbye tomorrow.
Amber, do you just want to talk briefly about an opportunity for reciprocal? I know it's competitive and we have to apply it.
Sure. Well, Fajar really put in most of the work. So again, this is a program from the State Department, and so part of this program is a reciprocal exchange. It's pretty competitive. Again, there's multiple fellows across the country in 5 different cohorts. And so it's a very competitive program. However, if anybody, all YSEALI fellows have to submit a reciprocal exchange proposal during their last week of the program. And so Fajar took the lead, and then I pitched in, and we kind of came up with an idea for a reciprocal exchange where I would travel to Indonesia for 2 weeks and work with him in Makassar on tuberculosis awareness and prevention. And so doesn't mean like we pitched the idea, I'm going to cross my fingers and do a little dance And if it gets accepted, then I would travel to Indonesia in late April of next year. If it doesn't, I'll cry in my pillow at night, but I will be okay, and I will still probably go back to Indonesia. I lived in Indonesia for a year. And so when I had the opportunity to host a fellow from Indonesia, I was very excited because the Indonesian people were so kind and hospitable to me. They made the year I spent in Indonesia one of the happiest, best years of my life, and the people were so kind and so hospitable. So when I had the opportunity to be a host to an Indonesian so that they could come to my country and they could also feel welcome, I relish that opportunity. So.
And you all guys very welcome if you come and visit to Philippines or Indonesia, just contact him.
Yeah, sure.
Of course.
Excellent. Thank you so much. Thank you. That's an incredible experience, I'm sure. And what a special thing to have here. So thank you for putting in the work, Drinda and Amber, to host, and to all three of you for your service to the health department.
Thank you.
I'll give kudos to Fred as well. He's the one that brought it to our attention. And the opportunity that came out of the Mansfield Center at University of Montana. So.
Well, thank you, Fred. Any last thoughts before we move on? All right. Agenda item number 8, Board of Health Effectiveness Assessment.
So, Mr. Chair and members of the board, I'll set the stage briefly, but and mostly for our 2 new board members, because the others have gone through this process over the last couple of years. Every year, the board looks at the governance functions, and we use a tool. We've adopted a tool by the National Boards of Health Local Boards of Health Association, and it takes us through a handful of functions. And the assessment has the board think through how well you as a board are doing in a variety of areas. And so it's time again to complete the assessment. Shannon, I might ask that we tag team it, and if you have the questions, which is I think the next page down in the packet, if you want to do that, I'll take notes on the form so that we can keep that documented and use it as decision making for improvement as we move through the year. But if you want to lead the conversation through the questions, that would be helpful.
Sure. So the questions are formatted in like yes, no responses, and also have room for examples. So as we were working through the questions under each of the governance areas, just keep that in mind. The form that Drinda is filling out is yes, no, and examples. So starting with policy development, this includes leading and contributing to the development of policies that protect, promote, and improve public health while ensuring that the agency and its components remain consistent with the laws and rules to which it's subject. These may include, but are not limited to, first question, developing internal and external policies that support public health agency goals and utilize the best available evidence. Any discussion on that question and how we as a board are implementing that? I would just say, I think we do a really good job of this in that we rely on our great health department staff who do a good job of this through the different assessments that we have, the annual, community health assessment, and the, is it every 3 years we do our, we revisit our priorities and use a lot of information from the community in that. So I would just mention those things. We're able, I think, to rely on those things and sort of like smaller scale projects that the health department staff do in making our decisions in a really informed way.
And I'll just add the on-site wastewater regulations were reviewed this year. And that's a Board of Health function. It is you as the Board of Health that sets those regulations. and reviews them on a regular basis. And this year you did do the on-site wastewater regulation as a local policy to protect our environment from wastewater impact.
Yeah. I think it's a great segue into the next question. If nobody has anything else to add to that first one. The next question, adopting and ensuring enforcement of regulations that protect the health of the community. I think the example Drenda just gave is a great one. Obviously, we have specific obligations under statute in order, in some areas, but I think from my perspective, we maximize our authority and the authority that the health officer has in order to enforce the things within our purview, wastewater, indoor air regulations, stuff like that I think are really protective of community health. Next, developing and regularly updating vision, mission goals, measurable outcomes, and value statements. Any thoughts on this? Or I think that some of the examples we've already talked about are really good at this. I think we could maybe improve or kind of demonstrate that we're, focused on this, but I think we could probably improve the frequency with which we visit these things. Obviously, we don't want to update our vision, mission, things like that all the time, right? We want to maintain some consistency, but I don't know. I think we could more regularly visit our broader policy kind of goals and make sure that the decisions we're making and sort of the programs that we're hearing about are advancing those. I will say one thing that Drenda has done in order to really help this is on our agenda items, tying the work we're doing as a board and the agenda items we have as a board to specific outcomes and goals and strategic priorities that the board has. And I think that's really, really helpful. That's been really helpful in the last, I don't know, a few months? I don't know when you started doing that, but.
Yeah, this past year has been, Dr. Badil made that recommendation last year. And so we made that edit.
Yeah.
And you'll have an opportunity because our strategic plan comes to a close in 2026. And so you'll be engaging in strategic planning with us starting the beginning of the year.
Excellent. Setting short and long-term priorities and strategic plans. What a great segue.
Ryan.
Any thoughts on this?
Maybe just on setting short and long-term priorities. I don't know, sometimes in other forums, we see the next month's agenda ahead and sort of identifying priorities and where that might fall during the calendar year of meetings. I don't know if that's something we've considered, but a way to talk about priorities and where we might actually discuss them.
Yeah. That's a great thought. I think a lot of what we do is, because we only meet once a month, is we don't necessarily know a month out what it's going to look like, but certainly I think for some items that would make sense, or at least having an idea of, of being able to identify, is this in alignment with what our goals are?
I think we have another opportunity as the new calendar year starts here pretty soon. We do have an internal Board of Health agenda calendar that we use internally to make sure that we're getting certain things in front of the Board of Health on a certain schedule. But I've used that as an internal tool. It sounds like you all are wanting to be a part of that process and setting the priorities and setting the calendar. So I think we can put that on the next agenda for the Board of Health meeting and look at that for 2026. And you guys can help drive the agendas.
Does that sound like what you were
Yeah, even if it's more of a somewhat more passive role, I'm not saying necessarily we need to drive the priorities, but at least to see where they are. So if we see something that's not reflected, we could possibly suggest it, but I personally do not intend to micromanage the calendar for the whole year.
I'll draft it and put it on the agenda and you all can provide the feedback.
Sounds good.
Yep.
Great. Ensuring the necessary policies exist, new policies are proposed or implemented where needed, and existing policies reflect evidence-based public health practices. I think that I don't think, I don't think we develop new policies that frequently, right? I don't know that there's a need to do that. What I will say is I think what exists, and I'm thinking back to that survey that you shared with us, that statewide sort of evaluation process that you shared with us, that really reflected that our health department is really outperforming other county health departments in most areas, right? Well, at least within the state. And so I think that that is a good indication to us that, if it's not broke, we don't need to fix it in most areas. So I don't know how much that applies, but those are my thoughts.
It also came to our attention this year during the legislative session that it would be helpful for the Board of Health to have a specific Board of Health policy around advocacy and lobbying. And so Shannon and I will be working on drafting that for your review in the new year. So that's another example of there was an identified need and we're working towards filling that with a policy that makes sense for the board.
And I think that also goes back to sort of us, we're able to do that because you identified that as, as the health officer and your staff, bring these issues to us really, in a timely way and in a really effective way. So again, thank you. We're relying on you for that. Next question, evaluating existing policies on a regular basis to ensure that they are based on the best available evidence for public health practice. I don't know. As a board, I don't know that we do this. I don't know if you do. I'm sure you do. I don't know that as a board we do this.
I'm trying to think of the last time that there's a really good obvious example, and it may have been like some tobacco policies that were happening in the community, and the health department and the Board of Health contributed to ensure that the city ordinance made sense and that it was a good, a good health policy. But that's been many years ago now, but that was an example of how the Board of Health and the health department engaged in kind of big P policy or, a policy that was heard before the city commission. But there are opportunities on a regular where the Board of Health is engaging in small P policy. And I think your resolutions are small P policies. You have stated that those are priorities and have used those as a way to communicate with the community and to the legislature, for example, that those are important policies for you. So I think those might be a couple of good small P policies that have happened more recently.
Just a question, again, in other contexts, sometimes there's a sort of like annual update that all employee policies and other policies are reviewed internally and the board is just informed that happens. Is there a regular time when you do that internally with?
Yeah, it's an ongoing and ever, we are reviewing our policies that's quite lengthy, and we have a lot of internal policies, and we have not included the Board of Health in those. If you would like to be, maybe Shannon and I can have a conversation about that.
Maybe
about
more,
a lot of our internal stuff.
Just as an update that it's happening.
Yeah.
It sounds like the board role is
making sure that it's happening.
Evaluating existing, do they exist? Are they updated? The board says, it sounds like you have a process, as opposed to actually being involved in your policy process. That might be a way to address that.
Yeah.
I interpret this to mean health policies. So that's where my brain went.
Yeah, and
fairly personal policies.
Right. Yeah, it's not super clear, but I think that's I guess you could read it either way. but I think those examples you gave, Drenda, are really great. And I think there are infinite opportunities to take positions like that. If we wanted to, or if something becomes important enough, significant enough, or affecting the community in such a way that we feel that's necessary. And so I would, I think just keeping that in mind as a board member, that any member can propose that the board, take adopt a resolution on an issue. Any other thoughts? Okay, let's move on to resource stewardship. Assure the availability of adequate resources to perform essential public health services. These may include, but are not limited to, ensuring adequate facilities and legal resources. I suppose that we don't have much control over legal resources, but we do have a county attorney's office that's very collaborative. As far as facilities, I know that we've had some discussion in the past about limited space, or rather, if the department needs to expand, there's not really space to do that. I'm not sure that we've talked about it much more than that.
We identified facility as a need in our last strategic plan 3 years ago. And rather than being able to find additional space, we ended up consolidating more staff into the inadequate space that was that. So I would say that we went backwards in that effort. And that was completely budgetary.
Yeah.
We had a need to consolidate because of the cost of rent in both locations. And so we figured out a way to get everybody in this building. So I would say that facility need still exists.
Yeah. So maybe it's a no for that. We maybe need to be more regularly, kind of more regularly consider space needs and within the resources that we have available. Any other thoughts? All right.
Maybe once the market cools a little, we can convince the commission to buy another building.
Yeah. Hey, plant the seed now. So
long term, there's lots of opportunities.
That's right.
Yeah. All right. Developing agreements to streamline cross-jurisdictional sharing of resources with neighboring governing entities.
Well, we heard some examples of that earlier with the addiction medicine resources.
Yeah. Yeah, that was exactly, yeah. I don't know, as a board, I don't know what role there is for us, but in that, other than, I guess we did, our resolution that we just passed was on a kind of federal issue. But I do think that the department staff are very good at working within these different, we just, that whole 12 county region for, that's certainly outside of the Board of Health, our kind of jurisdiction, but, and then I think Mary's program, she serves kind of a weird, an irregular sort of.
It's the St. Pete's service area.
Yeah.
So it includes more than Lewis and Clark.
Right.
Universal Home Visiting.
Right. So aside from providing direct services outside of the county, I'm not sure what else the department does, but I don't know that as a board I don't know what role we would have in that.
And the agreements that we have, so chronic disease is another example in that we receive funds from the state department, health department, to provide chronic disease prevention, cancer control, and tobacco prevention specifically in a region. So Lewis and Clark, Mar, Jefferson, Broadwater are all a part of that. And so then we have formal agreements in place with those other counties that we're going to provide that, or we're going to contract with a staff. So Jefferson is an example of tobacco. They have their own prevention specialists. And so we put a formal contract in place for them to receive funding to have their tobacco prevention specialist in Jefferson County. That all flows, they call us the hub. So we bring in the funds and then we serve our regional area. So that's an example, but the Board of Health doesn't play a big role in that other than hearing about as our programs come through and give you updates on the work that's happening. You're hearing about those regional partnerships that are occurring, but those the development of the agreements and the approval of those agreements are happening at the Board of County Commission. So because of formal agreements.
Yeah.
And they're funding related.
Yeah.
So, yeah.
And I imagine, you know, if Sherry were here, I imagine there's a lot of work in that kind of this collaborative work outside in the Water Conservation District. It's not just the county, is my understanding.
The Water Quality Protection District is
Yeah,
less than the county. So
It's less than-
so it's all Lewis and Clark County, but it's not the whole county. It's just a very small percentage of the county that receives services from the
I see.
Water Quality Protection District. Yes. Yeah.
Any other thoughts? All right, developing or approving a budget that is aligned with identified agency needs. Again, I think we approve the budget with the really great information that we're given from the staff. Very timely, having reviewed the quarterly report today. And yeah, I think the staff do a great job of identifying sort of current needs, how things are expected to change, how they're not expected to change, you know, things like that. As evidenced by our review today.
I think that what they're doing to set priorities is important. I mean, there's not a part of county government that couldn't do more if it had more money, but there's limits and setting, doing long-term planning for capital projects, for expansions of programs, is the way that you get these things done, and it just like having that budget money set aside, and being able to fund the staff side of things until we're waiting for DC to get off the dime, you know. So I think that long-term budgeting is critical, and again, very few local governments do it, and it's amazing the difference that we've been able to see in the short time I've been on the commission. We've been able to do some things I never dreamed we'd be able to because we planned ahead for it, and that has to be part of it is long-term planning and committing to projects, setting priorities and deciding, yeah, we'd like to have 6 people doing this, but we can only afford 3. Okay, what are those 3 people gonna zero in on, you know? And then what do we do to get the extra money to expand it if it's that important? So, but this is the budgeting has taken huge jumps in the right direction in my mind.
Yeah, absolutely. I think there's never been a time where we've had a question about the budget where we needed more information or anything like that we didn't get, or that was, you know, not explained. So I think, yeah, I really appreciate all of the work that you do, Drenda, to make sure that we are informed. Exercising fiduciary care of the funds entrusted, or I'm sorry, I skipped one. Engaged in sound long-range fiscal planning as part of the strategic planning efforts. We just kind of talked about that. Exercising fiduciary care of the funds entrusted to the agency for its use.
So making sure that we're using the funds as intended.
Yeah. Yeah.
A lot of that comes to our grant reports. But there are property tax dollars that we use for the work that we do, and you know, that the oversight of the work that happens is yours as a board. So making sure that the way that we budgeted is the way that we're spending, or being good stewards of those public dollars that we have to do the work.
The budget detail we receive, that
actual expenditures. It's not just big line items that are lots of things grouped. So I think I appreciate the transparency and level of detail we see.
Yeah. All right, advocating for necessary funding to sustain public health agency activities when appropriate from approving or appropriating authorities. Again, very timely question. I think we've been talking about this a lot. Our last meeting, we passed that resolution. Commissioner Rolfe mentioned sort of this maybe transition of responsibility from the federal government to the states and kind of imagining what that would look like moving forward. And I think that's a discussion we need to keep having as we see, you know, how things change and develop. But we, I think, have been very engaged in this specific sort of, you know, responsibility.
And I've frankly been surprised. We approved this morning applying for a $2 million grant from the feds that I didn't think would be coming now. And I think we're in a position to compete favorably for that grant. So it's not, well, it's sort of health related, but it's more substance abuse and mental illness related, and jail diversion. And all of a sudden this grant came up, and we're going to take a run at it, see if we can get it. And that's a federal grant where I was, you know, I think I said last time that I thought we're going to see more locals. Well, here's a federal grant that I wasn't expecting.
Yeah. Excellent. Well, hopefully the county is successful in that application. Any other thoughts on that? And I'm noting the time, it's 2:41, and I know we have one additional presentation. Do we want to pause here to hear the presentation and then maybe come back to this if we run out of time next meeting?
I think we could finish this section because they're just a few announcements at the end of the agenda.
Okay, so do you want me to go through legal authority?
Yeah, through the, it looks like there's just 2 more questions. I'm looking at a different form because there's.
Oh, we finished the resource stewardship section.
Did we?
Yeah.
Okay. Yeah, the form I'm using is different because it, yeah, they updated I put the old one in your packet.
Oh.
And then I grabbed the new one for me to take notes on, and it's different than the one you're looking at. So, yeah, let's save a legal authority and partner engagement for next meeting. Last year, it took us a couple meetings to get through all of these as well. So if the board's comfortable with that, we could just tackle these a little at a time over the next few months and get them done.
Yeah, that sounds great. Thank you, Brenda.
Yeah.
All right. Well, thank you all for your input and thoughts on that. It's so important that we kind of engage in this self-evaluation every year. And so I really appreciate your time doing that and look forward to our future discussion on those points. But in the interest of everybody's time, I guess let's move on to the next agenda item, number 9, data dashboard updates.
And Val is prepping that because I didn't have Sandy do that in advance, so she's doing that right now.
It'll take a few minutes to load, so if you want to.
Okay, I'll do a couple of other announcements while she's doing that, and then we'll circle back around to the data dashboard. So WIC was the other announcement. I think we adequately covered that during the financial conversation, just that we are still waiting for those grant funds to come. We're holding out and we are covered until the end of November. So wanted to bring that to the board's attention, and thank you, Dr. Nass, for prompting that question. The Clean Indoor Air Act anniversary is next week. And so wanted to just bring that back to your attention. It was emailed, but wanted to remind everyone, next week, the 29th at 5:30 at Brothers Tap Works down in the Walking Mall is a celebration. It's the 20th anniversary of the Clean Indoor Air Act. So I'll be there. Hope to see maybe some of you stop down and celebrate with us. And then the final announcement, and it looks like I'm in perfect timing because Val has the dashboard up. The state of Montana is putting together Board of Health Resources, and they're looking for a couple of board members that might be willing to do some review. There's a couple virtual meetings, and if anybody's interested in participating, they're doing it for you. And so they're looking for your feedback. So if anybody would like to joining at short virtual meetings to share their thoughts. So you'll have an opportunity to look at resources in advance and then share your feedback. So let me know if you're willing.
Yeah, do we have anybody who might be interested in that?
Any schedule on that?
No schedule at this point. They're looking for volunteers, and it's a short commitment. Like they're looking for maybe just a couple of virtual meetings where you can pop on and give some feedback after reviewing materials.
Yeah, sign me up.
Thanks, thanks.
Great.
Perfect. All right, and then the final item is kudos to Val, because she has been working so hard to keep our data dashboard fresh. She's migrated over to a new platform that has been really great, easy to navigate. And then she's building out these pages. So you can see that she has an air quality page. The 2024 community survey was put out there. And the most recent addition was this the communicable disease page. So I thought it would be helpful just to bring you back to this dashboard, let you see what's there. And then we can show off the communicable disease section of the dashboard here. So it allows you to select categories, because there's a lot of communicable disease that we are required to track. So there's active surveillance that is happening in our community on a daily basis. And so we track foodborne and waterborne, respiratory, STD, STI, and vector-borne. That includes like mosquito-borne diseases and Lyme disease. And you can see some of the ones that the conditions that are listed are the ones that are by law required to be reported to us. So we know that we are going to get this information. Phil, I don't want to put you on the spot, but please jump in if there's other information. But it's super user-friendly. It's easy to use. If you're really wanting to know what our flu rates are right now, you can go specifically to she has a flu page just for that, and you can compare over time. I particularly like that one because back in 2021 and 2022, we didn't have a flu season hardly. And it's because everybody was doing extra protections because of COVID. And so the protections that worked against COVID also worked against the flu. So we hardly had a flu season back then, but it's fun to see it in this way.
Do we have any data, like, and I mean, obviously not real time, but current year data?
We do. And it's in that summary. Is it in that summary? The 2024, 2025. Oh.
So I believe for influenza, the data for the current year cases are not reflected here as of right now. And
that's being helpful to encourage vaccination.
Sure, yeah. And similarly, the flu season summaries, these are sort of put together at the end of a flu season. And so I could absolutely add in current year cases.
Back on the other page, the case by condition, can you get, like, I thought I saw.
Yes.
Because there's no reported at this point, so
in terms of the, you guys are gonna go down a little rabbit hole with me on, how to make decisions on displaying this kind of information. But in terms of the charts that you see here, you're not going to see 2025 because I don't know, it was more of a subjective call that it might confuse folks who don't understand quite what they're looking at, that if we're in the beginning of a year, you're gonna see.
It's gonna look great.
Yeah, and it was a little, it was tricky to figure out, like, how do I provide this summary information in a way that is gonna resonate and make sense with the majority of folks.
And the season transcends years. It starts in 24 and goes into 25. And so the 25 data you're seeing is from last flu season.
Yes, so flu season was brought into another page, just because we think about flu season and cases and hospitalizations in a very odd time frame that everything else that doesn't really fall into that category. So when you're looking at the visualizations, you're not going to see the current year. However, and this is not really explicitly stated anywhere, but if you download the data, you will get all current data up to, and this is not updated daily and automated. That is something that I haven't decided yet what the best cadence for that would be, but I'm thinking likely monthly, maybe quarterly. That's more of a conversation that I'll probably rely on Shelley and our providers to tell me how frequently they would like to see those numbers. And I will say that for the majority of we're very fortunate that we don't have, for a lot of these, for some of them, this is not the case, but for a lot of them, we don't see high numbers of cases very regularly. And so updating them more frequently, and it didn't really make a lot of sense because it's usually 0 for most of the reportable diseases. But perhaps for some of the more common ones, especially when we're thinking about STI or STDs and things like that, that have higher rates, we might have different cadence on when we update those numbers, but we haven't really figured that out yet.
It would be awesome if we had there's a lot of different ways to go about this, but some sort of visualization for the patients who are like, oh, I mean, I never get the flu, or come January, oh, what's the point in getting a flu shot now?
Do we have a wastewater sample that reflects flu yet, or is it still just COVID?
We are getting the samples are being done, and Val is working on getting it populated. And
Yes.
so it will have its own space on here.
Yes, there's nothing here yet. So if you click on this button, you will not see anything.
But it's happening.
But it is in development. There are a number of things that are in the development stage and just haven't been launched publicly yet. So the wastewater surveillance is one of them. And yes, we are.
Will that show kind of real time spikes in weekly?
We'll show weekly levels of the viral concentrations in wastewater. Yes, which can be. I'm not as I haven't done a lot of research on wastewater surveillance for influenza. There was, of course, when the COVID-19 pandemic hit, there was a ton of money in research that went into doing research on utilizing COVID-19 wastewater surveillance as a proxy or a potential warning system for future hospitalizations, to kind of give a warning signal to maybe hospitals that, hey, you might start seeing some more hospital admissions. But I'm not quite sure if what the research says on the influenza yet, but it's very likely that it's out there, and I just don't know the answer to that. So I can look into that though, but we are monitoring for it. And similar to COVID, you'll see fluctuations in the viral loads. And I think recently we started seeing some influenza A popping
we
up.
have a chronic level of COVID in our community and have had for years now. But it is this time of year that we're going to start to see some others. And so we are monitoring COVID, influenza A, influenza B, RSV, and measles. Those are all being monitored in the wastewater right now.
Yeah, and I'm excited to get this up. And do I have time to go on a tirade?
You were the last on the agenda, so you took
Okay. Well, I just wanted to, I'm really excited to get the wastewater surveillance information out there, because one thing that's really challenging in providing a data portal like this, I don't leave a lot of space for this. This really isn't intended to provide interpretation or analysis or communication. It's the main audience is providers, our key stakeholders, folks who really need access to regular real-time information. And if interested people from the public look at it too, fantastic. But my primary audience is folks who need the data and need to look at that regularly. But with that said, for something like like COVID, let's just look at that, for example. When folks look at, when we're just looking at number of cases, I think a lot of folks maybe don't connect the dots of this should be interpreted so cautiously because we only know if we have a case if folks are testing and reporting, right? So do we have folks with COVID-19 in our community? Probably, I would guess so. Was it as precipitous of a drop as this? Also probably no, because what also coincided with a drop is a lot of folks no longer are getting tested at clinics or hospitals. And so when our testing rates go down, we're just not capturing that in our cases. So you're not really going to see the same kinds of more helpful or accurate trends. When everyone and their mother was getting tested for COVID, it was a pretty good proxy for how much prevalence we had in the community and what our incidence was. But now that's not really the case. So insert wastewater surveillance data. It's a really helpful tool because regardless of what our testing rates are, or if anyone's getting tested, we still have a decent proxy for how much of the virus is circulating in our community. It's not perfect. It shouldn't be interpreted as like, oh, if you see X in the wastewater, that means X hospitalizations. Like we can't do that level of modeling at a local level. But it's still really helpful. So that was just a long plug-in for how cool wastewater surveillance is and how helpful it can be, especially when we don't have testing resources. We've also added measles into the mix. And so we're monitoring for both types of influenza, RSV, measles, and COVID-19. And RSV is not a reportable disease, so it's also nice that we're able to have some level of surveillance tool for RSV because we don't actually know how many cases we have.
Any talk of adding pertussis to that mix?
I haven't heard of any conversation. In terms of wastewater surveillance? Yeah, no, I haven't heard any conversations about pertussis, but they're constantly adding more and more to their toolbox, and it's usually just a matter of funding. There's one Stephanie Otto Hit. Am I pronouncing her last name correctly?
Yeah.
Yeah, she's like one scientist at Carroll College that does all of this, and not just for our county, but for counties all over the state. And so
3 counties total. And it's at 4 locations.
Yes.
2 are ours, Helena and East Helena.
And then
so the limitation on our wastewater data is that it's the Helena wastewater system and the East Helena wastewater system, which is, I recognize that folks living in the valley probably work in town and use the facilities in town, but we're not capturing wastewater from septic systems in the valley, right?
Sure.
So, and then Haber and Butte. So there are four locations that Carroll College is managing for wastewater surveillance.
And I just brought that up because I think it would be fantastic if we could keep expanding that program. But I think, our resources are really limited. And I think Stephanie's she's doing so much. And I'm so grateful for that partnership.
And it's federally funded.
Yeah.
And there's a national wastewater surveillance database that our data from Montana and from our community flows up into this national database, and that is handled through the CDC. And I'm not even sure if they're keeping that current right now.
They are.
They are. They must have an automated system. With nobody.
Or they kept at least one person on.
Yeah.
So I noticed they're still updating their measles information to national. So anyway, but this is a resource for you if you ever want to get raw data or want to have access to that. If you have any questions at all.
Can you send us a link?
Yes, and just to also let me go.
Or is it just readily available on the site?
Yes, I'll show you. I think it's on our main page. So this is our main public health. Once you get to the county website and then navigate to public health, our county website can be quite a maze sometimes. But once you get here, there's a big link to that.
Okay.
So
right in the front.
Yeah.
Where's the milk? Big white jug, top shelf in the middle. I'm good at that.
Yeah, but if anyone ever has any questions about that, please let me know. And basically every main section that you saw in the community health assessment, long term, those will be reflected in the online data portal. So we're constantly building new pages. You just don't see a lot of it very often. But more to come.
Yeah. And as Val completes a section, I'll just have her come and show you.
Yeah,
I
that's
think
awesome.
she didn't need to be here today, but look at that. She did such a beautiful job of showing her hard work.
And I do have like 30 seconds left. And I just wanted to say, well, I'm still working on my elevator pitch for the data portal. But one thing that you said, I think I might try to connect somehow and tie this into a bow, because we started out with financial planning and talking about sustainability. And was the phrase that you used event planning or planning for inevitable catastrophes and making sure that you have, I think there was a phrase that you used. And giving Drenda props for making sure that, okay, we expect that this is going to happen. And so let's plan now and make sure that we have the resources available for when that day probably is going to come. And
it's just like in your personal life,
yeah,
the car's gonna need brakes, but
Yeah.
when? Yeah,
Right.
So you.
That's what the data portal.
Yeah.
Well, it's not the only thing that motivates me for creating this, but it's certainly a big part of the inspiration, which is recognizing that we will likely continue to be asked to do more with less resources, staffing wise, and the data collection part is so foundational, as you all probably understand, to informing what our priorities are, what we're focusing on, and it takes a lot of staff time. It takes a lot of effort. Even the communicable diseases part. In the past, that's kind of landed on Shelley and our nursing team, who's already so swamped. And monthly, quarterly, annually, it would take a lot of time for them to get all that information, put it in a report, create the report, send that out. And so by building this infrastructure, it just resonated with me. I'm like, yeah, it's not money, but it is infrastructure planning for the future and understanding that we're trying to make all of our processes a little bit more efficient and getting those little efficiency wins that will hopefully add up to big wins over time.
And maybe explain just a little more in a different setting, something that happened in the county budgeting process this last year. We had a bridge that was a problem, and the people weren't going to be able to get to their cattle or to get propane into their ranches because of this bridge problem. And once we got an agreement with the neighboring landowner to use part of that hill, we had money set aside to get a used bridge, temporary bridge, so we could set something up. And we spent $50,000 to get a used bridge. And as soon as we got the agreement with the landowner, we had it in place in less than a month. If we'd have waited for a new bridge, it would have been 2.5 times as expensive and would have taken a year. And we'd have left people stranded on the other side of the bridge. So by having that emergency fund sitting there, we were able to temporarily solve the problem right away. And now we've got 2 or 3 years to look for ways to come up with $1 million to permanently replace the bridge.
That's a great example.
Yeah.
Thanks for sharing.
Yeah.
Well,
this probably won't have that big of a financial return on investment so quickly, but hopefully it brings some.
But if the thing that hit me just like a ton of bricks was, we wouldn't have had that opportunity if we didn't have the emergency fund set aside.
Yeah.
Yeah. And so sometimes your ability to take advantage of the opportunity is because you did a little planning long term.
Yeah.
Yeah.
All right. We are 4 minutes over. So I'm going to and I'm going to wrap up, but thank you so much for the information and the updates. That looks very different from the last time we got an update on the dashboard. So clearly a lot of work has been put into it. We'll move on to public comment. I don't know if we have any members of the public online, but we'll open the meeting to public comment or any thing within the board's authority or jurisdiction.
No comments from the public.
None in the room? All right. Well, then we are adjourned. Thank you.
Oh, don't forget that next meeting, it's the November, December combined meeting, and